Welcome back to our channel, guys. Today we will be looking at Tinea corporis, commonly known as ringworm. Did you know that ringworm is not a worm? Tinea corporis is a fungal infection that affects the skin. It is usually a ring-shaped, reddish rash that can be very itchy. Yes, guys, it's just like a temporary tattoo. Tinea corporis with treatment will take 4 to 6 weeks to heal. The team and I, consisting of Alleshia, Anissa, Sasha Gay, and Judith, will be hitting the streets to hear the people's view on what they think ringworm is. And of course, we will be educating the people on the microorganism that causes Tinea corporis, the portal of entry and exit, how to prevent and treat the infection, and definitely the role of the nurse. You are in for a very informative presentation. Stay tuned, guys.
Welcome back to our channel. It's Nursing Squad
2020.
It's your girl Sasha.
And your girl Yanique.
And your girl Judith.
And your girl Alleshia.
And it's your girl Anissa.
And today we're in
Cool Mandeville.
So today we're gonna be talking about, we're gonna be asking a couple of people about Tinea corporis, aka ringworm. So we are gonna ask you because we wanna know what you know,
So we can tell you what we know.
Good afternoon. What is your name?
Wayne.
My name is Yanique, and today I'll be asking you a few questions.
Yes, miss.
Have you ever heard about Tinea corporis?
No, miss.
Never?
Never, yes.
Anything come
Okay,
to
so what
mind?
about ringworm?
Ringworm, yeah, we think about ringworm.
Okay, so how do you think you catch ringworm?
But I know that then time you loose in the loose water, them and the dirty, dirty water.
Okay. And how do you treat it?
Well, you have to treat it and take care of it. But I want to put something from the pharmacy, rub up with it and avoid it.
You ever catch it before?
No, miss, but I want to look at children, you know, and some little relatives come in, catch it and I always buy them some little tools and rub it.
Okay. And how do you think you stop it from spreading?
Well, end of the day, long as I see them start with it, you know, you have to get the things, the remedy for it and get rid of it.
Okay.
That's no spread.
Alright. So yeah, everything that you said about ringworm is true, but the word Tinea corporis, that is scientific name for ringworm.
All right, miss.
Alright.
So every day you learn something new.
Alright, thank you so much. Here?
Yes, please. Love you.
Alright.
Good afternoon, ladies.
Good afternoon.
And how are you today?
Okay.
Okay, can you go ahead and give me your names, please?
My name is Casey Garden.
Okay.
My name is Colleen Morrison.
Okay. Have you guys ever heard of the term Tinea corporis before?
No.
When I say Tinea corporis, what comes to mind?
Something.
Something? Okay, ever hear of ringworm?
Yes.
What do you know about ringworm? Do you know how you catch it?
Yes, like if I use like dirty water.
Yeah.
Okay, and when you catch ringworm, do you know exactly what to do to treat it?
Well, we normally use like ointment.
Uh-huh.
People always say like garlic and bleach and
Wait a minute. Wait a minute. Wait, first of all, you're not going to speed past that like you didn't just say what you just said.
Okay.
Right, or lime.
Yes, those are some remedies as well.
Yeah.
And how about after catching the ringworm, what do you do at home to prevent other persons from actually contracting it?
You like keep away from them or you just cover it or something. You know, just
Okay, well, Tinea corporis, that's another name for ringworm. So all of what you said is indeed correct. So prevention, you can clean it, and keep it dry.
Yeah.
Don't cover it. You're not supposed to cover it. But you clean it, keep it dry, and whatever you use, you don't use it again. You wash it before using it. Okay? Well, that is it, ladies, and thank you very much for your time.
Yeah, well.
All right? Okay.
Good afternoon, sir. How are you? Okay. My name is Judith Thomas. What is your name? Sangyu. What? Sangyu. Okay, Sangyu. Today I want to ask you some questions, right? When I say the word Tinea corporis, what comes to mind? Nothing. Okay, nothing at all. No, that word doesn't. That word long too. Okay, alright. Do you know ringworm? Yes. How does it look? Bump on the skin and spread. Okay. Have you ever caught it before? Yeah, man, but I was small. And what do you use to treat it? Lime. Lime? Lime. So what to do with the lime? You just cut the lime and just rub it like lime on it. Okay. Did it get better? Yes. Okay. Alright. So, good. That's my 2 questions. Alright.
Good afternoon. My name is Anissa, and yours is?
Jason,
And how are you doing today?
I'm doing okay.
All right, great. When you hear the word Tinea corporis, what come to mind?
Tinea corporis. No come to mind.
All right. When you hear ringworm, how you know about catching ringworm?
Dirty water.
Okay, all right, makes sense. And you ever catch ringworm before?
No.
You know of anybody who has caught it?
No.
All right. You ever hear like your parents or your grandparents tell you how to treat ringworm?
No, sir.
Never hear that yet?
Mm-mm.
All right. Being we never hear nothing before. So the Tinea corporis that I mentioned earlier, it's basically the scientific name for ringworm, right? So basically you catch it from like dirty water, as you mentioned, or the soil or anything, and it comes on your skin, right? And basically for treatment you use like ointments, and you have home remedy. People that say like lime or ackee or stuff like that, but you mainly get ointments prescribed by your doctor. Alright? Alright, so thank you so much. Have a great day.
Alright.
Good afternoon.
How you doing?
I'm not going so good.
I don't know what's going on with you.
My daughter passed out.
I'm really sorry to hear about that.
Yeah.
What's her name?
Patsy.
I'm really sorry to hear about that, Patsy.
Okay.
So today I'm just going to be asking you some questions about Tinea corporis. Have you ever heard that name before?
Huh?
Have you ever heard about Tinea corporis before?
No.
Okay. What comes to mind when I hear that word?
I wonder what you're talking about.
Well, Tinea corporis is a scientific name for ringworm. Have you ever heard about ringworm before?
Yeah.
Have you ever caught it before?
Yes.
Alright. What does it look like?
Some fine bump. And it crutch.
It itch. Okay. And where you normally used to treat it if you ever get infected?
You have something what they call name blue. Blue. What you use rinse clothes.
Oh,
Yeah.
use that for treat it?
Yeah, you take a rub on it.
And it clear it off?
Yeah.
You prevent it, or you think you prevent it from passing on to anybody else?
You just make the person stand by there herself or you stay by yourself and don't make you catch somebody, because when you go bound somebody, it will catch somebody too.
Okay, good. Well, you did give some good points there. Some other tips that that you can use to treat ringworm. They have the ointments that are prescribed by doctors.
Yeah.
All right. And you can regularly wash your bedding. You don't share personal items. Those tips can also help you prevent ringworm.
Yeah, you change your clothes, don't put it on with the other rest of clothes then.
Right.
You have to the ones it or something while you're catching and crutch.
Right.
You crutch too, so
Yeah.
you have to know, so you have to stand by it. That's you have to stand by it. No one else clothes basket by itself.
Right.
And wash it by itself. Yeah.
All right. Well, thank you. It was really good talking to you today.
Huh?
It was really good talking to you today.
Yes, they are very good.
in the town of Mandeville asking persons about ringworm, right?
Yes.
The scientific name, is Tinea corporis, right? Persons gave us a few things that they thought about ringworm. Persons didn't really know much about ringworm. Most of the persons spoke about using home remedies for treatment, and also most of them relied on knowledge from grandma or mother, parents, right?
But no medical. No one actually spoke about, actually visiting the doctor or getting consultation from a physician. So we're actually going to give correct preventative methods and also treatment for home remedies. They use home remedies like the garlic and the lime and the salt. So what we're going to speak on now is the medical aspect.
The first thing I would encourage someone who has ringworm to do is visit their nearest health center, right, and get treatments. They would normally see a nurse, see a doctor, and the treatment they would get would be like beconazole, tinidazole, or clotrimazole.
Yes, and those are actually ointments. They can get them from over the counter or they can be prescribed. So when you get those, the pharmacist or the doctor will actually tell you how to apply. What happens is you need to wash the area with soap and water. Ensure that it's dried thoroughly. Keep it dry. Don't use bandage on it. Ensure that Ensure that the linens or clothes that you wear is washed thoroughly.
And washed each time it is used.
Yes.
And sometimes if the fungus is really bad, right? If the ringworm is really bad, doctor would prescribe oral medication, such as terbinafine and there are others, but that is one of the popular ones that they normally prescribe.
But it's mostly, you can get medication over the counter.
And thorough education is needed. So when they are educated, they should be educated about how to prevent it from coming back, and also how to prevent others in the house from catching it.
That is where the linen and actually cleaning the area, washing your hands after actually touching the rash or anything like that. That is where that comes in.
Okay.
Tinea corporis microorganisms. The causative microorganisms is called Tragophyton rubrum. Tragophyton are dermatophytes which inhibits the soil, animals, or humans related to its natural habitat. The infection can be characterized by granulomatous lesions of the skin. It may be distinguished by a pigmented shade of white to cream, yellow to brown, and deep to red. Tragophyton rubrum can form both macrocnida and microcnida. Macrocnida occurs in large numbers with terminal projections, while microcnida occurs in various shapes and sizes. Two types may be distinguished: T. rubrum downy type and T. rubrum granular type. Unsubered glucose agar, growth moderately slow, texture downy and sometimes powdery. Intermediate strain between the types occur.
Portals of entry. This is the site through which microorganism enters a susceptible host and causes infection. There is also the portal of exit through which microorganisms leave the host. Tinea corporis can enter the skin through tiny cracks of the epidermis, open wounds, and inhaling particles of infected skin or fungus. The fungus is primarily anthropophilic. The portal of exit is also the skin. They do this by creating spores. There are three main ways in which Tinea corporis may be transmitted. Direct skin-to-skin contact. This is where the individual comes in physical contact with another person. This could be by hugging or touching. Indirect contact. The infection can be spread by the contact with an object used by an infected person, Example, towel, clothing, and bedding. Airborne. It is mostly spread through the contact with spores. Once the spores travels in the air, it may then infect a person.
Treatment. Tinea corporis, otherwise known as ringworm, can be treated by using topical terbinafine and itraconazole. This is given to patients to treat more extensive cases of the infection. The doctor may recommend applying terbinafine of 250 to 500 milligrams per day to the infected area for 2 to 6 weeks and itraconazole of 100 to 200 milligrams per day for 2 to 4 weeks or until the infection is cleared. Healthcare for patients. Doctors may also recommend certain behaviors as a treatment for Tinea corporis. These may include avoiding clothes that irritates the affected area, cleanse the environment by washing bedding and clothing daily, regular hand washing, and constantly cleaning the body. Precaution. Self-aware and aware of others. The risk of Tinea corporis infection is very high for human-to-human transmission. Individuals should be aware of the signs and symptoms of the infection, and children should be educated to avoid getting infected. Keeping clean. Individuals should wash hands regularly to avoid transmission, as well as public areas such as schools, sports clubs, childcare centers, and locker rooms should be kept clean, and regular sanitization must be done. Keep skin dry. Moist skin increases the chance of getting infected. Individuals should avoid clothing that may cause excessive sweating in hot weather for prolonged periods. Avoid infected animals. Animals can easily pass on the infection. If an animal is infected, it normally appears in a specific area with no fur. This may not be the case for all infected animals, so they should visit the veterinarian periodically to have proper medical checks done. Avoid sharing personal items. One can contract the infection by sharing with others, therefore avoid sharing clothes, towels, and other personal belongings. Children should also be excluded from schools and swimming pools until the appropriate treatment is administered. Role of the nurse. The primary role of the nurse is to advocate and care for individuals of all ethnic origins, religious backgrounds, and support them through health and illness. They provide knowledge, health tips, and prevention for Tinea corporis, such as proper medication and home remedies. Nurses will also advise on different antifungal creams to administer to the infected area as well as the prescribed periods for use. They also inform of antifungal tablets that can be taken for the treatment of Tinea corporis as another option. That's it for today, guys. Hope this video was informative. If you have any questions, please leave them in the comment section below. Bye.